What is the role of metabolic monitoring in surgical care? Metabolic monitoring involves tracking glucose levels, electrolytes, and acid-base balance to identify and correct metabolic derangements that can affect surgical recovery. How does pain management impact surgical physiology? Effective pain management reduces stress response, improves patient comfort, and facilitates recovery by enabling early mobilization and reducing the risk of chronic pain. What are the physiological considerations in managing blood transfusions during surgery? Considerations include blood type compatibility, volume and rate of transfusion, monitoring for reactions, and managing coagulopathy to ensure safe and effective transfusion. How does perioperative nutrition affect surgical outcomes? Adequate nutrition supports wound healing, immune function, and overall recovery. Preoperative optimization and postoperative nutritional support are essential for surgical patients. What are the implications of stress response modulation in surgical patients? Modulating the stress response through pharmacological and non-pharmacological means can reduce complications, improve recovery, and enhance overall outcomes in surgical patients. How does tumor biology influence treatment decisions? Tumor biology, including genetic mutations, growth rate, and metastatic potential, guides treatment decisions by determining the aggressiveness and specific therapeutic targets. What are the basic principles of oncology that every surgeon should know? Principles include understanding cancer biology, tumor staging and grading, treatment modalities, surgery, chemotherapy, radiotherapy, and the importance of a multidisciplinary approach. What is the significance of tumor staging in oncology? Tumor staging assesses the extent of disease spread, guides treatment planning, prognostication, and helps standardize clinical trials for better comparability. How are surgical margins determined in oncologic surgery? Surgical margins are determined based on tumor type, location, and surrounding anatomy. Clear margins are crucial to minimize recurrence and may require intraoperative pathology assessment. What are the key considerations for sentinel lymph node biopsy? Considerations include identifying the sentinel node using tracers, accurately removing it for pathological evaluation, and guiding further treatment based on node status. What are the roles of adjuvant therapies in oncology? Adjuvant therapies, including chemotherapy, radiotherapy, and hormonal therapy, target residual cancer cells post-operatively to reduce recurrence risk and improve survival. How do targeted therapies differ from traditional chemotherapy? Targeted therapies specifically inhibit molecular pathways involved in cancer growth, offering a more precise treatment with potentially fewer side effects compared to traditional chemotherapy. How does immunotherapy work in treating cancer? Immunotherapy stimulates the patient's immune system to recognize and attack cancer cells, using agents like checkpoint inhibitors and CAR T cells to enhance anti-tumor response. What are the principles of palliative care in oncology? Palliative care focuses on symptom management, quality of life, and psychosocial support for patients with advanced cancer, addressing pain, nausea, fatigue, and emotional needs. What are the common indications for cardiothoracic surgery? Indications include coronary artery disease, valvular heart disease, congenital heart defects, thoracic aortic aneurysms, and lung cancer, among others. How is coronary artery bypass grafting, CABG, performed? CABG involves using grafts from veins or arteries to bypass blocked coronary arteries, improving blood flow to the heart muscle and reducing symptoms of angina. What are the key considerations in valve replacement surgery? Considerations include selecting the appropriate valve type, mechanical or biological, assessing patient factors like age and comorbidities, and ensuring precise surgical technique. How are thoracic aortic aneurysms managed surgically? Management includes open surgical repair or endovascular aneurysm repair, EVAR, depending on aneurysm size, location, and patient condition to prevent rupture and related complications. What are the challenges in lung cancer surgery? Challenges include ensuring complete tumor resection while preserving lung function, managing complex anatomical variations, and addressing potential postoperative complications like pneumonia. How does minimally invasive surgery benefit cardiothoracic patients? Minimally invasive techniques, like video-assisted thoracoscopic surgery, VATS, and robotic-assisted surgery, reduce postoperative pain, shorten recovery time, and minimize complications. What is the role of extracorporeal membrane oxygenation, ECMO, in cardiothoracic surgery? ECMO provides temporary cardiopulmonary support for patients with severe cardiac or respiratory failure, allowing time for recovery or serving as a bridge to more definitive treatment. How is congenital heart disease managed surgically? Management includes corrective or palliative surgeries tailored to specific defects, like septal defects, tetralogy of Fallot, and transposition of the great arteries, often performed in specialized centers. What are the principles of postoperative care in cardiothoracic surgery? Principles include monitoring hemodynamic status, managing pain, preventing infections, ensuring adequate respiratory function, and facilitating early mobilization to promote recovery. How do advancements in cardiothoracic surgery improve patient outcomes? Advancements like improved surgical techniques, better perioperative care, enhanced imaging, and novel therapies contribute to higher success rates, lower complication rates, and better overall outcomes. How is wound healing optimized in plastic surgery? Optimization involves meticulous surgical technique, appropriate wound closure methods, infection prevention, and postoperative care, including dressing changes and monitoring. What are the primary goals of plastic surgery? Goals include restoring form and function, enhancing aesthetic appearance, and improving patient quality of life through reconstructive and cosmetic procedures. What is the role of skin grafts in reconstructive surgery? Skin grafts, including split thickness and full thickness grafts, are used to cover defects, promote healing, and restore the integrity of the skin after trauma, burns, or surgical excision. How are flaps used in reconstructive procedures? Flaps, which involve transferring tissue with its blood supply, are used to cover complex wounds, reconstruct defects, and provide functional and aesthetic restoration, with options including local, regional, and free flaps. What are the key considerations in breast reconstruction surgery? Considerations include patient preference, oncological safety, choosing between implant-based and autologous reconstruction, and timing of the procedure, immediate or delayed. How is facial trauma managed surgically? Management involves restoring structural integrity, functional recovery of oral and ocular functions, and aesthetic restoration using techniques like open reduction and internal fixation, ORF, and soft tissue repair. What are the principles of hand surgery and plastic surgery? Principles include restoring function, sensation, and appearance, managing conditions like fractures, tendon injuries, nerve injuries, and congenital anomalies with precise surgical techniques. How are burns treated surgically? Treatment includes debridement, skin grafting, flap coverage for deep burns, and contracture release, focusing on functional and aesthetic recovery along with long-term scar management. What are the ethical considerations in cosmetic surgery? Ethical considerations include patient autonomy, informed consent, realistic expectations, and ensuring patient safety and well-being, avoiding unnecessary or harmful procedures. How do technological advancements impact plastic surgery? Advancements like 3D printing, laser technology, and minimally invasive techniques improve precision, reduce recovery times, and enhance outcomes in both reconstructive and cosmetic procedures. What are the common indications for urologic surgery? Indications include benign prostatic hyperplasia, BPH, urolithiasis, urologic cancers, prostate, bladder, kidney, urinary incontinence, and congenital urologic anomalies. How is BPH managed surgically? Surgical management includes transurethral resection of the prostate, TURP, laser therapy, and newer techniques like UroLift, aimed at relieving urinary obstruction and symptoms. What are the principles of managing urolithiasis? Principles include minimally invasive techniques like shockwave lithotripsy, SWL, ureteroscopy, and percutaneous nephrolithotomy, PCNL, to remove stones along with preventive strategies. How is prostate cancer treated surgically? Treatment options include radical prostatectomy, either open or robotic-assisted, with considerations for nerve-sparing techniques to preserve erectile function and urinary continence. How is kidney cancer managed surgically? Management includes partial or radical nephrectomy, with laparoscopic or robotic approaches preferred for minimizing recovery time and preserving kidney function when possible. What are the surgical approaches to bladder cancer? Approaches include transurethral resection for superficial tumors, radical cystectomy for invasive cancer, and urinary diversion techniques post-cystectomy to maintain urinary function. What are the techniques for managing urinary incontinence? Techniques include sling procedures, artificial urinary sphincters, and bladder augmentation, tailored to the underlying cause and patient-specific factors. How are congenital urologic anomalies addressed surgically? Addressing anomalies like hypospadias, vesicoureteral reflux, and obstructive uropathy involves reconstructive techniques to restore normal anatomy and function. How does robotic surgery enhance urologic procedures? Robotic surgery offers enhanced precision, improved visualization, reduced blood loss, and faster recovery, making it a valuable tool in complex urologic surgeries like prostatectomy and pyeloplasty. What are the common indications for vascular surgery? Indications include atherosclerotic disease, aneurysms, peripheral arterial disease, varicose veins, and vascular access for hemodialysis. How is peripheral arterial disease managed surgically? Management includes endovascular techniques like angioplasty and stenting, as well as open procedures such as bypass grafting to restore blood flow to affected limbs. What are the key considerations in aneurysm repair? Considerations include the size and location of the aneurysm, patient comorbidities, and choosing between open surgical repair and endovascular aneurysm repair, EVAR. How is carotid artery stenosis treated? Treatment options include carotid endarterectomy, CEA, and carotid artery stenting, CAS, to prevent stroke in patients with significant stenosis. What are the principles of managing varicose veins? Principles include conservative management with compression stockings, sclerotherapy, and surgical options like endovenous ablation or vein stripping for symptomatic relief. How is vascular access created for hemodialysis? Access is created using arteriovenous fistulas, AVFs, or grafts, chosen based on patient-specific factors to provide long-term, reliable access for dialysis. What are the challenges in managing chronic limb ischemia? Challenges include ensuring adequate revascularization, managing pain, preventing infection, and addressing risk factors like smoking and diabetes to improve outcomes. How do advancements in imaging impact vascular surgery? Advancements in imaging such as duplex ultrasonography, CT angiography, and MR angiography provide detailed views of vascular anatomy and pathology, guiding precise surgical interventions. What are the key post-operative care considerations in vascular surgery? Considerations include monitoring for complications like bleeding, graft occlusion, and infection, as well as optimizing anticoagulation therapy to prevent thrombosis. How does patient education improve outcomes in vascular surgery? Educating patients on lifestyle modifications, medication adherence, and recognizing signs of complications empowers them to participate actively in their care, enhancing long-term outcomes. What are the common conditions treated in pediatric surgery? Conditions include congenital anomalies like Hirschsprung's disease and congenital diaphragmatic hernia, appendicitis, pyloric stenosis, and pediatric tumors. How is Hirschsprung's disease managed surgically? Management involves removing the aganglionic segment of the intestine and creating an anastomosis with the normal bowel, often using minimally invasive techniques. What are the considerations for managing congenital diaphragmatic hernia? Considerations include stabilizing the infant, repairing the diaphragmatic defect, and addressing associated pulmonary hypoplasia and hypertension for optimal outcomes. How is appendicitis treated in pediatric patients? Treatment involves prompt surgical removal of the inflamed appendix, appendectomy, either via open or laparoscopic approach to prevent complications like perforation and peritonitis. What are the principles of managing pyloric stenosis? Principles include correcting electrolyte imbalances preoperatively and performing a pyloromyotomy to relieve the obstruction, typically through a minimally invasive approach. How are pediatric tumors approached surgically? Approach involves complete surgical resection when feasible, often combined with chemotherapy and/or radiotherapy, tailored to the specific tumor type and stage. What are the unique challenges of pediatric anesthesia? Challenges include managing smaller airways, different pharmacokinetics and dynamics, and ensuring adequate pain control while minimizing risks in the pediatric population. How is postoperative care tailored for pediatric patients? Postoperative care involves close monitoring for complications, pain management, nutritional support, and addressing the emotional and developmental needs of the child. What is the role of minimally invasive surgery in pediatric patients? Minimally invasive surgery offers benefits like reduced pain, quicker recovery, and smaller scars, and is increasingly used for a variety of pediatric conditions. How do family-centered care practices impact pediatric surgery outcomes? Family-centered care, involving parents and decision-making in care, enhances satisfaction, reduces anxiety, and supports the child's emotional well-being, improving overall outcomes. What are the primary goals in trauma surgery? Goals include rapidly assessing and managing life-threatening injuries, stabilizing the patient, and planning definitive surgical repair to minimize morbidity and mortality. How is the primary survey conducted in trauma patients? The primary survey follows the ABCDE approach: airway, breathing, circulation, disability, exposure, to identify and address immediate threats to life. What are the key considerations in managing hemorrhagic shock? Considerations include rapid identification and control of bleeding, fluid resuscitation, blood transfusion, and monitoring for signs of ongoing hemorrhage and hemodynamic instability. How is traumatic brain injury managed surgically? Management involves intracranial pressure monitoring, decompressive craniectomy for severe cases, and addressing associated injuries like skull fractures or hematomas. What are the principles of damage control surgery? Principles include performing only necessary interventions to control bleeding and contamination initially, followed by definitive surgery once the patient is stabilized. How are thoracic injuries managed in trauma patients? Management includes ensuring adequate ventilation, chest tube insertion for pneumothorax or hemothorax, and addressing major injuries like cardiac tamponade or aortic rupture. What are the challenges in managing abdominal trauma? Challenges include rapid identification of injuries to solid organs and hollow viscera, controlling hemorrhage, and preventing contamination and infection in cases of perforation. How is pelvic trauma addressed surgically? Surgical management involves stabilizing the pelvic ring, controlling associated bleeding, and addressing urogenital or rectal injuries that may complicate the trauma. What is the role of interventional radiology in trauma care? Interventional radiology plays a crucial role in minimally invasive techniques like angiographic embolization to control bleeding, offering a valuable adjunct to surgical intervention. How does a multidisciplinary approach improve trauma care outcomes? A multidisciplinary approach involving surgeons, emergency physicians, anesthesiologists, and critical care specialists ensures comprehensive care and optimizes outcomes for trauma patients. What are the common indications for orthopedic surgery? Indications include fractures, joint dislocations, degenerative joint disease, osteoarthritis, sports injuries, and congenital orthopedic conditions. How are fractures managed surgically? Surgical management involves open reduction and internal fixation, ORF, intramedullary nailing, or external fixation to restore alignment, stability, and function of the fractured bone. What are the principles of joint replacement surgery? Principles include selecting the appropriate prosthesis, ensuring accurate alignment and fixation, and minimizing complications like infection and dislocation to restore joint function. How are sports injuries addressed surgically? Management includes arthroscopic techniques for ligament repairs, like ACL reconstruction, meniscal repairs, and addressing cartilage damage to restore function and enable return to sports. What are the considerations for managing pediatric orthopedic conditions? Considerations include growth potential, avoiding growth plate damage, and addressing specific conditions like clubfoot, developmental dysplasia of the hip, and scoliosis with appropriate techniques. How is osteoarthritis treated surgically? Treatment options include joint debridement, osteotomy, and joint replacement surgery, tailored to the severity of the disease and patient-specific factors to relieve pain and improve function. What are the challenges in managing orthopedic trauma? Challenges include ensuring proper alignment and fixation, managing soft tissue injuries, preventing infection, and addressing complications like non-union or malunion of fractures. How does rehabilitation impact outcomes in orthopedic surgery? Rehabilitation is crucial for restoring function, strength, and mobility, involving physical therapy, occupational therapy, and tailored exercise programs to optimize recovery and outcomes. What are the key considerations in spine surgery? Considerations include ensuring proper alignment, decompression of neural elements, stabilization with instrumentation, and addressing underlying pathologies like herniated discs or spinal stenosis. How do advances in orthopedic technology improve surgical outcomes? Advances such as computer-assisted surgery, 3D printing for custom implants, and biologics like growth factors and stem cells enhance precision, improve recovery, and lead to better outcomes in orthopedic surgery. What are the respiratory physiological considerations in surgery? Considerations include maintaining adequate ventilation, oxygenation, and airway management, especially in patients with pre-existing pulmonary conditions. How is fluid balance managed in surgical patients? Fluid balance is managed by assessing blood loss, fluid shifts, and electrolyte status, and administering appropriate fluids and electrolytes to prevent required for complete tendon ruptures, especially in active individuals. Early intervention and rehabilitation are critical for optimal recovery. What are the considerations for managing neurovascular injuries associated with fractures? Prompt identification and management are essential. This includes surgical repair of damaged vessels or nerves and ensuring adequate blood flow to the affected limb. How do pediatric fractures differ from adult fractures, and how are they treated? Pediatric fractures often involve growth plates and may be green stick or buckle fractures. Treatment focuses on proper alignment and monitoring for growth disturbances. What role does rehabilitation play in the recovery of musculoskeletal trauma? Rehabilitation is crucial for restoring function, strength, and mobility. It involves physical therapy, exercise programs, and patient education to ensure optimal recovery. What are the key components of evidence-based surgical practice? Evidence-based practice involves integrating clinical expertise, patient values, and the best available evidence from systematic research to guide surgical decisions. How do randomized controlled trials, RCTs, contribute to surgical evidence? RCTs provide high-quality evidence by minimizing bias and allowing comparison of interventions. They are considered the gold standard for evaluating treatment efficacy. What is the importance of systematic reviews in surgery? Systematic reviews compile and analyze data from multiple studies, providing comprehensive evidence to guide clinical practice and inform guidelines. How does meta-analysis enhance the interpretation of research findings? Meta-analysis statistically combines results from several studies, increasing the power and precision of estimates, helping to identify trends and draw stronger conclusions. Can you explain the hierarchy of evidence in surgical research? The hierarchy of evidence ranks study designs from systematic reviews and RCTs at the top to expert opinion and case reports at the bottom, based on their reliability and bias risk. What are common sources of bias in surgical research, and how can they be mitigated? Biases include selection, performance, detection, and reporting biases. They can be mitigated through randomization, blinding, proper study design, and transparent reporting. How does the PICO framework assist in formulating clinical research questions? The PICO framework, patient, intervention, comparison, outcome, helps structure clinical questions, making literature searches more efficient and focused on relevant evidence. What role does critical appraisal play in evaluating research studies? Critical appraisal involves systematically assessing research studies for validity, reliability, and applicability to ensure they provide robust and relevant evidence for clinical practice. How do clinical guidelines based on evidence improve patient care? Evidence-based guidelines standardize care, reduce variability, and ensure that patients receive interventions proven to be effective, improving outcomes and efficiency. What is the Cochrane Collaboration and how does it support evidence-based practice? The Cochrane Collaboration is an international network that produces high-quality systematic reviews and meta-analyses, providing reliable evidence to inform healthcare decisions. How does a thorough understanding of anatomy benefit surgeons? A thorough understanding of anatomy allows surgeons to perform procedures safely and effectively, avoiding complications and ensuring optimal patient outcomes. What are the critical anatomical landmarks in abdominal surgery? Key landmarks include the iliac crest, inguinal ligament, rectus sheath, and various planes like the transpyloric and intertubercular lines, aiding in accurate incision and dissection. How is the anatomy of the inguinal region relevant to hernia repairs? Understanding the inguinal canal's anatomy, including the inguinal ligament, internal and external rings, and surrounding structures, is crucial for effective and safe hernia repairs. What are the major anatomical considerations in thoracic surgery? Major considerations include the structures of the mediastinum, pleural cavities, and vital organs like the heart and lungs, ensuring precise navigation and avoidance of complications. How does knowledge of vascular anatomy assist in surgical planning? Knowledge of vascular anatomy, including the location and course of major arteries and veins, is essential for planning incisions, avoiding vascular injury, and managing hemostasis.
What role does anatomical variation play in surgical practice? Anatomical variations can affect surgical approaches and outcomes. Surgeons must be aware of and adapt to these variations to prevent complications and ensure successful procedures. How is the anatomy of the neck relevant to thyroid and parathyroid surgeries? Understanding the neck's anatomy, including the thyroid gland, parathyroid glands, recurrent laryngeal nerves, and vascular structures, is crucial for safe and effective thyroid and parathyroid surgeries. What are the anatomical challenges in pelvic surgery? Pelvic surgery challenges include the complex arrangement of organs, blood vessels, and nerves. Detailed anatomical knowledge helps avoid complications like bleeding and nerve damage. How does understanding the physiological response to surgery benefit surgical outcomes? Knowledge of the physiological response helps predict and manage complications, optimize perioperative care, and improve patient outcomes by tailoring interventions to individual needs. Why is cross-sectional anatomy important in modern surgical practice? Cross-sectional anatomy, visualized through imaging techniques like CT and MRI, provides detailed views of internal structures, aiding in accurate diagnosis, surgical planning, and intraoperative navigation.
How does anesthesia affect cardiovascular physiology? Anesthesia can impact heart rate, blood pressure, and vascular resistance, necessitating close monitoring and adjustments to maintain hemodynamic stability during surgery. What are the key physiological changes during the perioperative period? Key changes include stress response activation, alterations in cardiovascular and respiratory function, metabolic shifts, and immune modulation, all requiring careful management. How is peripheral artery disease, PAD, diagnosed and managed? PAD is diagnosed using ankle brachial index, ABI, Doppler ultrasound, and angiography. Management includes lifestyle changes, medications, and revascularization procedures like angioplasty or bypass. What are the surgical options for treating abdominal aortic aneurysms? AAA. Options include open surgical repair and endovascular aneurysm repair, EVAR. Choice depends on aneurysm size, location, and patient comorbidities. How is carotid artery disease treated to prevent stroke? Treatment includes medical management, carotid endarterectomy, CEA, or carotid artery stenting, CAS, depending on the severity of stenosis and patient risk factors. What are the key considerations in managing deep vein thrombosis, DVT? Management involves anticoagulation therapy, compression stockings, and monitoring for complications like pulmonary embolism. In severe cases, thrombolysis or thrombectomy may be required. How are varicose veins treated surgically? Treatments include sclerotherapy, laser ablation, radiofrequency ablation, and surgical ligation and stripping. The choice depends on the severity and patient preference. What role does imaging play in vascular surgery? Imaging modalities like duplex ultrasound, CT angiography, and MR angiography are crucial for diagnosing vascular conditions, planning interventions, and postoperative follow-up. How is critical limb ischemia managed surgically? Management includes revascularization procedures like angioplasty, stenting, or bypass surgery to restore blood flow and prevent limb loss. What are the complications associated with vascular surgery? Complications can include bleeding, infection, thrombosis, embolization, and graft failure. Prompt recognition and management are essential. How do you assess and manage a patient with chronic venous insufficiency? Assessment includes clinical evaluation and duplex ultrasound. Management involves compression therapy, lifestyle modifications, and in severe cases, surgical intervention like vein ablation or stripping. What is the ABCDE approach in trauma care? The ABCDE approach prioritizes airway, breathing, circulation, disability, and exposure to systematically assess and manage trauma patients, ensuring life-threatening conditions are addressed first. How is a traumatic brain injury, TBI, assessed? TBI assessment involves the Glasgow Coma Scale, GCS, neurological examination, and imaging like CT scans to determine severity and guide management. What are the signs and management of a tension pneumothorax? Signs include chest pain, dyspnea, tracheal deviation, and decreased breath sounds. Management involves immediate needle decompression followed by chest tube insertion. How is abdominal trauma evaluated using FAST? FAST, focused assessment with sonography for trauma, evaluates for free fluid in the abdomen, indicating potential internal bleeding, guiding the need for further intervention. What is the initial management for a patient with suspected splenic injury? Initial management includes hemodynamic stabilization, monitoring, and imaging. Non-operative management is preferred for stable patients. Surgery is required if unstable. How is liver trauma managed? Management ranges from observation and supportive care for minor injuries to surgical repair or embolization for significant bleeding, depending on hemodynamic stability and injury severity. What are the priorities in managing pelvic fractures? Priorities include stabilizing the pelvis with binders, assessing for associated vascular and organ injuries, and managing hemorrhage, often requiring multidisciplinary care. How are bladder and urethral injuries diagnosed and treated? Diagnosis involves clinical assessment and imaging like retrograde urethroplasty. Treatment includes catheterization, surgical repair, and monitoring for complications like infection or stricture. What is compartment syndrome and how is it treated? Compartment syndrome involves increased pressure within a closed muscle compartment, leading to ischemia. Treatment involves urgent fasciotomy to relieve pressure and restore blood flow. How is blunt cardiac injury managed in trauma patients? Management involves monitoring for arrhythmias, echocardiography to assess structural damage, and supportive care. Severe cases may require surgical intervention. How are fractures classified and managed initially? Fractures are classified by type, open, closed, co-minuted, and location. When are surgical management used and what are their benefits? Pain surgical drains are used to remove fluid collections such as blood. How should joint dislocations be managed in the emergency setting? Abscess formations require prompt monitoring, post-operative bleeding and preventing anesthesia, followed by immobilization, ergonomics and surgery assessment to ensure proper alignment and to reduce surgeon fatigue. What are the challenges in managing spinal injuries? Spinal fractures require immobilization and assessment for neurological deficits. Of long-term surgical stabilization may be necessary for unstable fractures or significant spinal cord compression. Early mobilization reduces the risk of complications like deep vein thrombosis are treated with rice, promotes faster recovery, compression, and improves overall outcomes. Pain management and gradual rehabilitation to restore function and prevent chronic issues. Postoperative wound care what are the signs and treatment options for compartment dressing changes? Signs and monitoring for signs of infection to promote healing and prevent complications. complications. Treatment involves emergency fasciotomy to relieve pressure and prevent permanent damage. And when should each be used? Sutures and staples are used for wound closure. Sutures are more versatile and can be used for deeper tissues, while staples are quicker to apply and often used for skin closure. Can you explain the benefits of laparoscopy over open surgery? Laparoscopy offers benefits such as reduced recovery time, less post-operative pain, and smaller scars compared to open surgery. It is minimally invasive and often preferred for certain procedures. What are the guidelines for antibiotic prophylaxis in surgery? Antibiotic prophylaxis should be tailored to the specific type of surgery to prevent surgical site infections. The timing and choice of antibiotics are critical to maximizing efficacy. Why is VTE prophylaxis essential, and what methods are commonly used? VTE prophylaxis is essential to prevent venous thromboembolism in at-risk patients. Common methods include pharmacological anticoagulants and mechanical devices like compression stockings. What are the early signs and management strategies for sepsis? Early signs include fever, tachycardia, and hypotension. Management includes prompt antibiotics, fluid resuscitation, and monitoring for organ dysfunction. Can you describe the phases of the inflammatory response and their significance? The inflammatory response has phases: acute, immediate, chronic, prolonged, and resolution. Each phase impacts healing and requires appropriate management. When is a blood transfusion indicated during surgery? Blood transfusions are indicated for significant blood loss to maintain hemodynamic stability. Preoperative cross-matching and preparation of units are necessary. How is anesthetic risk assessed preoperatively? Anesthetic risk is assessed using tools like the ASA classification, which helps evaluate and communicate potential anesthetic risks based on the patient's health status. How are biopsy techniques selected for different tumors? Selection depends on tumor location, size, and clinical suspicion. Techniques include needle biopsy for accessible tumors and excisional biopsy for smaller, superficial ones. Why are clear surgical margins important in cancer surgery? Clear margins reduce the risk of local recurrence, ensuring all cancerous tissue is removed. Intraoperative assessment can help achieve clear margins. Why is VTE prophylaxis essential, and what methods are commonly used? VTE prophylaxis is essential to prevent venous thromboembolism in at-risk patients. Common methods include pharmacological anticoagulants and mechanical devices like compression stockings. What are the recommended fasting guidelines before surgery? Patients are typically advised to fast for 6 hours for solids and 2 hours for clear fluids to reduce the risk of aspiration during anesthesia. Can you explain the role of nutritional support in the preoperative period? Nutritional support is vital, as preoperative nutritional status significantly impacts postoperative recovery. Supplements may be necessary for malnourished patients to improve outcomes and reduce complications. What are the guidelines for antibiotic prophylaxis in surgery? Antibiotic prophylaxis should be tailored to the specific type of surgery to prevent surgical site infections. The timing and choice of antibiotics are critical to maximizing efficacy. How does early enteral feeding benefit postoperative patients? Early enteral feeding supports recovery by maintaining gut integrity, reducing infection risk, and improving nutritional status compared to parenteral nutrition. What respiratory care strategies are used postoperatively? Respiratory care strategies include deep breathing exercises, incentive spirometry, and early mobilization to prevent atelectasis and improve lung function. How are abscesses managed surgically? Abscesses are managed through incision and drainage, followed by antibiotics to treat any underlying infection and prevent recurrence. What is the treatment protocol for cellulitis? Treatment involves appropriate antibiotics based on the causative organism and severity, along with monitoring for systemic involvement. How do you manage infection surveillance in postoperative patients? Regularly check for signs of infection, such as fever, increased white blood cell count, and wound changes, and implement timely interventions to manage infections. Why is patient education crucial in postoperative care? Patient education on wound care, activity restrictions, and signs of complications is crucial for ensuring proper recovery and preventing readmissions. What is the role of genetic counseling in surgical oncology? Genetic counseling helps identify hereditary cancer syndromes, informing surveillance, preventive strategies, and treatment options for at-risk patients. How does a multidisciplinary approach enhance cancer care? Collaboration among surgeons, oncologists, radiologists, and pathologists ensures comprehensive care, combining expertise for optimal treatment planning. What are the key considerations in using electrosurgery? Electrosurgery uses electrical currents to cut tissue and control bleeding. Key considerations include avoiding burns, ensuring proper grounding, and using the correct settings. How has robotic surgery changed the landscape of surgical practice? Robotic surgery enhances precision and control, especially in complex procedures. It offers improved dexterity and visualization, but requires specialized training and is often more costly. What is the significance of aseptic technique in surgery? Aseptic technique is crucial to prevent infections by maintaining sterility during procedures. It includes proper hand washing, wearing sterile gloves, and maintaining a sterile field. How do you select and handle surgical instruments effectively? Proper selection and handling of surgical instruments enhance efficiency and patient safety. Instruments should be appropriate for the procedure and handled with precision. What role does renal function monitoring play after surgery? Monitoring urine output and serum creatinine helps detect and manage acute kidney injury, ensuring timely intervention and preventing further complications. How is cardiac monitoring utilized in postoperative care? Cardiac monitoring is essential for high-risk patients to detect and manage arrhythmias, ischemia, and other cardiac complications early. What techniques are used to achieve hemostasis during surgery? Hemostasis is achieved using ligatures, clips, and electrocautery. Effective hemostasis is essential to prevent excessive blood loss and improve visibility during surgery. What role do tissue adhesives play in surgical wound closure? Tissue adhesives offer a quicker and less invasive method for wound closure compared to sutures. They reduce infection risk and are particularly useful for small incisions and superficial wounds. What are the principles of effective pain management postoperatively? Effective pain management involves multimodal analgesia, using a combination of medications to control pain and enhance recovery without excessive side effects. How is fluid balance managed in the postoperative period? Fluid balance is managed by closely monitoring intake and output, adjusting fluids to prevent dehydration or fluid overload, and addressing any imbalances promptly. What are the considerations for treating fungal infections in surgical patients? Treatment involves identifying the specific fungal pathogen and using appropriate antifungal agents, especially in immunocompromised patients. What is the importance of accurate tumor staging in cancer surgery? Accurate staging guides treatment planning, prognostication, and ensures appropriate surgical and adjuvant therapies are applied. How can catheter-associated infections be prevented? Preventive measures include aseptic insertion techniques, timely removal, and regular monitoring for signs of infection. How is necrotizing fasciitis diagnosed and treated? Rapid diagnosis via clinical assessment and imaging, followed by aggressive surgical debridement and broad-spectrum antibiotics, is essential. How does proper patient positioning impact surgical outcomes? Proper patient positioning is crucial to prevent nerve damage, pressure sores, and other complications during surgery, enhancing overall surgical outcomes. What are the critical aspects of monitoring during surgery? Continuous monitoring of vital signs, including heart rate, blood pressure, oxygen saturation, and end-tidal CO2, is essential to detect and address complications promptly. What are the benefits of adjuvant therapy post-operatively? Adjuvant therapy, such as chemotherapy, radiotherapy, or hormonal therapy, reduces recurrence risk by targeting residual microscopic disease. What considerations are involved in palliative surgery for cancer patients? Palliative surgery aims to relieve symptoms and improve quality of life in advanced cancer patients, focusing on symptom control rather than curative intent. How is survivorship care managed in cancer patients? Survivorship care involves long-term follow-up to monitor for recurrence, manage late effects of treatment, and provide ongoing support for patient well-being. What are the common indications for vascular surgery? Indications include peripheral artery disease, aneurysms, venous insufficiency, and carotid artery disease, often presenting with ischemic symptoms or risk of rupture. What are the common risk factors for surgical site infections? Risk factors include diabetes, obesity, immunosuppression, poor nutrition, and prolonged surgery. Addressing these can reduce infection rates. How does antibiotic stewardship impact surgical outcomes? Rational use of antibiotics prevents resistance, ensures effective treatment of infections, and improves overall surgical outcomes by reducing infection rates. What is the role of neoadjuvant therapy in cancer treatment? Neoadjuvant therapy, including chemotherapy or radiotherapy, is used to shrink tumors preoperatively, making them more resectable and improving surgical outcomes. How does sentinel lymph node biopsy improve cancer surgery? Sentinel lymph node biopsy is a minimally invasive technique that assesses regional lymph node involvement, guiding further treatment decisions.